Hello, PsychU community, and welcome to today's webinar, The Employer Role in Employee Mental Health and Wellness. My name is Dr. Tara McKinley, and I'm a Managed Market Liaison with Otsuka Pharmaceutical Development and Commercialization Incorporated. I'll be your moderator today, and I'm pleased to introduce to you Dr. Ken Duckworth and Dr. Fowls. This program is paid for by Otsuka Pharmaceutical Development and Commercialization Incorporated and Lundbeck LLC. So why is it and how have employers become such a driving force in the healthcare system and the mental health care system specifically?
Yeah, it's a good question, Taryn, and thanks for having us on today. Basically, I mean, there are many, many reasons employers are a major driving force, but four big ones come to mind. One has to do with the first number up there on the right. 49% of Americans insurance is sponsored by employers, and that's a Kaiser number. There are others actually estimated higher at 55%. So you're talking 160 to 180 million Americans who are covered by employer health insurance. The second reason is that most employers, meaning 84% of employers having employees of 500 or more, are self-insured. And what that means is they have kept the medical costs for themselves. And just to explain what that means briefly, typically in the past, employers would designate their administrative and medical costs to the insurers who would manage the whole ticket. But because it wasn't working as well for the employers as they wanted, they took back the medical costs. And so medical costs are typically 90% of the insurance premium, and employers still sub out 10% of the administration to the insurers. A third reason has to do with costs. Employers are facing continually increasing healthcare costs, and with better data, they're now seeing the results of high costs, high needs individuals that comprise typically 5 to 10% of their populations, but make up 50% of the costs. And what they're seeing in there is how behavioral health drives a lot of the cost and poor outcomes. So someone with depression and diabetes costs 2 to 3 times what someone with diabetes alone costs. And they're also seeing a lot of unmet behavioral health need in those numbers. And then finally, I think the employers are more enlightened, frankly. I think the opioid crisis, increased suicide rates, other things like that have impacted not just a subset of people, but everyone, including employers. And I think they're seeing that. And so they have become interested in things like parity, better behavioral health benefits, and so on. So the employers are in a major place to help drive insurance benefits.
So Dr. Duckworth, and I'll call you Ken. So what are your thoughts around how employers should be looking at, their benefits, or why is this important to them? And I know you've worked with a lot of employer groups. What are they doing today to help curb some of these rises in mental illness?
Sarah, I'd add to Don's thoughts that the pandemic changed the equation for a lot of people. And I think mental health went from a they problem to a we problem, because so many people either experienced something personally or cared about someone who did. And the CDC data showed that the numbers went from about 1 in 5 to about 2 in 5. They did a very large survey of people using screening tests that you would take at your primary care office, the PHQ-9, the GAD-7. And what they found was, 41.9% of Americans were reporting clinically significant symptoms during the pandemic. I think that changed how people think about this, and I think it changed how employers think about this. Employers then quickly realized, hey, that thing that people have been talking to us about is actually a genuine issue, and productivity is impacted by people's mental health and relapse for addiction, and that maybe we should, really take this on in a proactive way. That's what I have seen in my roles, both at NAMI and at Blue Cross, that employers are newly compelled to attend to their employees' needs. Not that they weren't interested before, but now I would say it's top of mind for people in a way that is new. And so it's a great opportunity now to think about this, because we do know that when you invest in good care for people, you are likely to save money and that presenteeism is actually an enormous problem in work. This is when people show up but are ineffective or disconnected from their work. And so, the idea is if you can get people, for example, who are depressed treatment, you can get an improvement in both as absenteeism, which is not coming to work, and presenteeism, which is even more common. And if you see on the right, the pie chart, my workplace stresses affects my mental health. A lot of people would endorse that. That's not particularly surprising because there's a reason they call it work. But how your culture impacts people's help seeking, how your benefit structure, and how you approach other resources for people is important.
Yeah, and as we do that, I know Ken, and you guys will probably touch on this as well, but access to healthcare has changed dramatically. I think everyone has heard this as a result of the pandemic, having telehealth, telemedicine, telepsychiatry, all the things that provide better care. And it seems, from what I've seen, employers are on board with this. Do you think it's here to stay?
Yeah, I think a couple things about access is, demand has exploded and supply has stayed very similar. So it takes 8 years to make a social worker and 8 months to make a mental health crisis. And what we've seen is that demand has greatly exceeded supply, and at the same time, avenues like tele, which now most everybody feels are effective, or phone sessions, which are frequently covered for people who don't have access to the internet, is a modality that many people will continue to use. I actually know some clinicians who've given up their offices and they're just going to do all virtual work going forward.
It's interesting too. I think that's absolutely, I totally agree with what Ken's saying, and I think one of the great examples of employers getting involved, and this is a little one-off, but not really. So here in Arizona, where I live, the governor passed an emergency bill, basically mandating that telehealth, behavioral health included, would be paid on as the same way as face-to-face visits. And that included not only video, but also audio alone. So here, where there's broadband access is a problem in the rural and frontier areas, people don't have internet. And it's really important to be able to access the phone and things like that. So, and then when the pandemic subsided, hopefully here, the legislature just made that emergency executive order permanent. And so telehealth is here in Arizona. I think you're going to see more around the country, if not already. And the relevance of this is our governor is the founder of Cold Stone Creamery. So he's a business guy at heart, and he's got a lot of business guys in his cabinet and in the legislature. And the business community is much more involved here with government than some other places might be. And parity passed without a single negative vote in the legislature, and similarly with telehealth. There was a massive support from the business community here to make telehealth available for people because it's very effective. It's a lot more convenient and turns out less expensive when you factor in some indirect costs like transportation, getting back and forth.